Okay, let's dive in. The numbers we're looking at right away are pretty stark.
They really are.
If you go back to, say, 1990, globally, maybe 200 million adults were living with diabetes.
Hmm.
Fast forward just, what, 3 decades to 2022? And that number has just exploded, 830 million.
It's incredible. More than quadrupled.
Think about that, that's huge. And the sources really hammer home that this increase isn't just happening, it's actually speeding up.
Yeah, it's accelerating, especially rapidly in low and middle income countries.
That rapid increase really does highlight the scale of the global health challenge we're facing with this condition right now.
Absolutely, it's massive.
So our mission today is a deep dive into diabetes mellitus. What is it fundamentally? Why has it become such a huge global issue, so quickly?
Right.
And maybe most importantly, what do the sources you've shared with us? We've got info from the WHO, Mayo Clinic, Stat Pearls, MSD Manual, American Heart Association. What do they tell us about how we prevent it, diagnose it, treat it, manage the complications?
Yeah, cut through the noise.
Exactly. We're here to cut through all that noise and get you, the listener, well informed on this really critical topic, and fast.
Exactly. This condition, it affects how the body uses blood sugar,
Mhm.
and these sources make it, well, undeniably clear why understanding it is more crucial than ever.
All right, let's unpack this then. What is diabetes mellitus at its core, according to these sources?
Fundamentally, diabetes happens when the pancreas either doesn't make enough insulin or the body just can't effectively use the insulin it does make.
Okay.
And insulin is this absolute vital hormone. It's like the key.
Mm.
It helps regulate blood glucose, which is basically blood sugar.
Right.
When that system's out of whack, blood sugar levels rise. A lot, we call that hyperglycemia. And critically, over time, this chronic high sugar damages all sorts of body systems, especially nerves and blood vessels.
So it's really a fundamental problem with how the body processes and manages the sugar that's circulating in the blood. It's not just about having too much sugar in your diet, necessarily. It's more about a breakdown in the body's internal system for handling it.
Exactly.
I saw a note in the sources about the history, which is kind of fascinating and points to this. The name itself, diabetes mellitus.
Oh, yeah.
It comes from Greek and Latin words meaning siphon or to pass through, and sweet.
Ah, right. Because of the urine?
Yeah. Goes way back to ancient times, observing sweet urine in people with the condition. They were basically noticing the body was flushing out extra sugar.
Yeah, that historical context shows how long we've seen the symptoms.
Yeah.
But our understanding, and especially effective treatment for type 1, that's relatively recent.
Right.
I mean, that massive breakthrough in 1922, purifying insulin from animal pancreases, that was just a game changer for survival for so many people.
Speaking of types,
Yeah.
these sources make it really clear there isn't just one kind of diabetes. That's a super important distinction, isn't it?
Oh, absolutely crucial.
Can you walk us through the main types?
Definitely. There are several, but the major ones are type 1 and type 2.
Okay.
Type 1 is characterized by, well, a deficiency in insulin production. And that's because, as the sources explain, the body's own immune system has attacked and destroyed the insulin-producing cells, the beta cells, in the pancreas.
So it's an autoimmune thing, like the body mistakenly attacking itself.
Exactly.
And for type 1, the cause and prevention are still largely unknown, right? Genetics seem to play a role, maybe environmental triggers like viruses.
Precisely. We don't have a clear cause or prevention strategy yet.
Yeah.
It used to be called juvenile diabetes, and yeah, it often starts in childhood or teenage years, but honestly, it can show up at any age.
Interesting.
And it's also interesting, the sources note that most of the, estimated 9 million people worldwide with type 1, they live in high-income countries.
Huh. Okay, so type 1 is about the body destroying its own insulin factories, leading to basically a no insulin. What about type 2? That seems to be the one driving those exploding global numbers we started with.
Correct. Yeah, type 2 is way more common. Accounts for over 95% of cases, according to these sources.
Wow.
And here, the primary issue is usually insulin resistance. The body's cells, they just stop responding properly to the insulin that's there.
Ah, okay. So the key is there, but the lock is jammed.
That's a good way to put it. The pancreas might still be producing insulin, sometimes even high levels at first, but it's just not enough to overcome this resistance and get the glucose out of the blood and into the cells effectively.
And the symptoms for type 2, they can be really subtle, right? Or even non-existent for a long time.
They can be very mild, yeah.
Yeah.
And take years to even notice, which is a huge problem because it often leads to diagnosis getting delayed.
Right. So by the time someone finds out.
By the time someone is diagnosed with type 2, complications might have already started developing. And yet it was formerly known as adult onset, but concerningly, we're seeing it much more frequently in kids and adolescents now.
That's a huge shift, isn't it? Ties back to lifestyle factors, I guess.
It does.
What about the type that happens specifically during pregnancy?
Gestational diabetes. That's hyperglycemia, high blood sugar that occurs during pregnancy. The blood glucose levels are up, but usually not quite high enough to count as overt diabetes outside of pregnancy.
And you find it through screening usually, not symptoms?
Exactly. It's typically diagnosed through routine prenatal screening tests. While it's often temporary, disappearing after birth, it does carry increased risks, complications during pregnancy and delivery.
Okay.
And importantly, it significantly increases the risk for both the mother and the child developing type 2 diabetes later in life. So it's a really critical warning sign.
Got it. And there's also that state that's sort of in between normal blood sugar and full-blown diabetes.
Yes, prediabetes. The sources define this as an intermediate condition. Blood glucose levels are higher than normal, but not quite hitting the threshold for a diabetes diagnosis.
Are there specific numbers for that?
Yeah, they give thresholds. Fasting glucose between 100 and 125 milligrams per deciliter, or a 2-hour reading after a glucose tolerance test between 140 and a 199.
And the key takeaway there?
The key takeaway is that people with prediabetes are at very high risk of progressing to type 2 diabetes. But, and this is important, the sources also emphasize it's definitely not inevitable.
Okay.
That progression can often be prevented or at least delayed.
That's a really important point of hope in the sources, isn't it?
Absolutely.
And they briefly mentioned other less common types too, like MODY, maturity onset diabetes of the young, and secondary causes linked to other conditions or maybe medication.
Right, it shows the complexity.
It's clearly a complex family of conditions, even if type 1 and type 2 are the big ones we hear about most.
Yeah.
What's fascinating, though, looking across these types, is how varied the actual problem is, either not making insulin or the body ignoring it even though the result is the same. High blood sugar.
That's a great point.
Which brings us naturally to the why. What exactly is going wrong inside the body? Can you break down how insulin normally works and then what changes in diabetes?
Sure. So think of insulin like a key, right? Made by your pancreas. Normally, after you eat, your blood sugar goes up. Your pancreas releases insulin, and that insulin key unlocks your cells, muscle, fat, liver cells, letting glucose move from your bloodstream into the cells.
For energy.
For energy, or to be stored for later. And this whole process effectively lowers the amount of sugar floating around in your blood.
Okay, makes sense. And in diabetes, that system breaks down.
Exactly. In type 1, because those beta cells are destroyed, there just aren't enough keys, not enough insulin being made. Glucose is trying to get into the cells, but there's no key to open the door, so it piles up in the blood.
Right.
In type 2, it's more like the locks on the cells get rusty or resistant to the key. The pancreas might even pump out more keys, more insulin initially, but eventually just can't keep up with that resistance, or the pancreas gets tired out. And again, glucose builds up in the blood.
So type 1 is that autoimmune attack on the beta cells we talked about, maybe triggered by something like a virus interacting with a genetic predisposition?
Correct. That's the thinking.
And for type 2, that insulin resistance, it sounds like it has multiple causes.
Oh yeah, it's really multifactorial. The sources strongly link it to obesity and aging, excess fatty acids circulating, inflammation.
Okay.
And genetics play a huge role too.
Yeah.
Maybe even bigger than people realize sometimes.
Really?
Yeah, the sources point out it runs strongly in families. And there's this really striking statistic about identical twins. If one has type 2, the other has about a 90% chance of developing it too.
Wow, 90%. That's huge. That really underlines the genetic susceptibility.
It does. They've even identified specific gene locations, like one called TCF7L2, that significantly increase risk.
But the sources also use a really powerful example to show that genetics isn't the whole story, right? Something about the Pima Indians.
Yes, that's a classic example they cite. You have genetically similar Pima Indians living in Mexico following a more traditional lifestyle. And they have a significantly lower prevalence of type 2 diabetes compared to Pima Indians living in the U.S., who generally adopted a more Western diet and, a more sedentary lifestyle.
That comparison is incredibly compelling. It clearly shows that while genetics might load the gun, maybe, environment and lifestyle factors are crucial in pulling the trigger.
Exactly. It ties right back to why those global stats are shifting so rapidly as lifestyles change around the world.
And the long-term damage from that chronic high blood sugar, How does that actually happen, like on a cellular level?
Well, high glucose levels over long periods cause something called non-enzymatic glycation. Sounds a bit technical.
Break it down.
Basically, excess sugar molecules just kind of spontaneously stick onto proteins and lipids all over the body,
Mm.
especially in blood vessel walls. They don't need an enzyme to do it. They just glom on because
Yep.
there's so much sugar around. And this process, this glycation, it damages those structures, particularly the small blood vessels, over time. And it's this widespread small vessel damage that directly leads to many of those classic, really devastating complications we associate with diabetes.
Like the damage we see in the eyes, kidneys, nerves. Okay. Before we get deeper into complications, though, what are the first signs someone might actually notice? Things that would make them think, maybe I should get checked out.
Yeah, the common symptoms listed across these sources include things like increased thirst, needing to pee more often than usual, especially noticeable at night,
Okay.
blurred vision, feeling unusually tired or weak, losing weight without trying, unintentional weight loss.
Anything else?
You might also see other things like cuts or sores, healing really slowly, getting more infections than usual, maybe feeling irritable.
Do those symptoms show up differently depending on the type of diabetes?
Yes, quite significantly.
Mm.
In type 1, because the insulin deficiency happens relatively quickly, the symptoms often appear pretty suddenly and tend to be more severe. With type 2, like we said, the symptoms can be really mild. They can creep up over many, many years, which is why type 2 so often gets diagnosed late, sometimes only when complications are already starting to show up.
That's a major challenge. And there are also acute situations, right? Like really dangerous emergencies if blood sugar gets way out of control.
Absolutely. Two big ones. Diabetic ketoacidosis, or DKA, is more common in type 1.
Okay.
It happens when that severe lack of insulin forces the body to break down fat for energy instead of glucose. This produces acidic byproducts called ketones.
Right. I've heard of ketones.
Yeah, they build up, make the blood acidic, that's acidosis, and cause symptoms like fruity-smelling breath, nausea, vomiting, deep, rapid breathing. It's serious.
Definitely sounds like it. What's the other one?
Hyperosmolar hyperglycemic syndrome, or HHS. This one's more common in type 2. Here, the glucose levels get extremely high,
How high?
like sky high, which leads to severe dehydration, confusion, sometimes even seizures. But usually without the significant ketone production you see in DKA, because there's still some insulin around in type 2, just not working well.
Okay.
But both DKA and HHS are absolute medical emergencies. Need immediate treatment.
It sounds like a huge problem on an individual level for sure. And those epidemiology stats you mentioned earlier, they paint an even bigger picture, a massive global challenge.
They really do drive home the scale. Let's revisit those WHO numbers. 830 million adults in 2022. It's 14% of all adults.
15%.
A huge jump from 7% back in 1990. And that alarming increase is happening fastest in low and middle income countries.
And type 1 is increasing too.
Yeah, the incidence of type 1, though it's less common overall, is also increasing worldwide for reasons we don't fully understand yet.
And for type 2, while it used to be more of an older adult thing,
Right, the typical onset used to be later in life. But the sources all highlight this really worrying trend of increasing rates in younger people, children, adolescents, young adults, and that's clearly linked to the global rise in obesity and more sedentary lifestyles.
what about in the U.S. specifically?
In the U.S., the prevalence is around 9% overall, but it jumps way up to about 25%, a quarter of those over 65.
Wow.
And these sources also highlight significant ethnic disparities. Certain minority groups have 2 to even 6 times higher risk compared to white individuals.
That's a huge disparity.
It is. And the projections, they predict this continued global increase, potentially hitting 642 million adults with diabetes by 2040. Just think about the burden on healthcare systems, communities, economies worldwide.
Wow. Those aren't just abstract numbers, are they? They mean diabetes is touching communities, families, healthcare systems everywhere on an ever-increasing scale. Understanding this is more critical than ever.
Absolutely.
So how do doctors actually figure out if someone has diabetes, and then how do they keep track of it over time?
Diagnosis usually involves measuring blood glucose levels. There are a few key tests. A fasting blood glucose test.
After not eating overnight.
Right. A random blood glucose test, which can be taken anytime. And the hemoglobin A1C test, often just called A1C.
Okay, what are the numbers? What are the diagnostic thresholds the sources mention?
According to the sources, a fasting glucose of 126 milligrams per deciliter or higher is diagnostic, or a random glucose of 200 or higher. But that's usually combined with having classic symptoms like the thirst and urination,
Got it.
or an HbA1c level of 6.5% or higher. Any of those on usually 2 separate occasions confirms diabetes.
And that A1C test, that's particularly useful, you said, because it gives a longer-term picture.
Exactly. Unlike a single snapshot from a fasting or random test, the A1C reflects your average blood sugar levels over the past 2 to 3 months.
Ah,
It gives a much better sense of your overall long-term control. So it's a standard tool for both diagnosis and monitoring. There's also the oral glucose tolerance test, the OGTT.
where you drink the sugary drink.
Yeah, exactly. You drink a standard sugary liquid, and they test your blood sugar before and then usually 2 hours after. It's used a lot for diagnosing gestational diabetes and sometimes for borderline cases of type 2.
Why is screening so important, especially for type 2, if the symptoms can be so subtle?
Well, precisely because type 2 can be asymptomatic for years, screening is absolutely crucial. It helps identify it early, ideally before complications start developing.
Makes sense. When should people get screened?
The sources generally recommend screening starting around age 45, or maybe earlier, between 40 and 70 if you're overweight or obese.
Okay.
And there's also a long list of risk factors for type 2 that would warrant earlier or more frequent screening. Things like having a family history of diabetes, being sedentary,
Right.
being overweight or obese, having a history of prediabetes or gestational diabetes, if you've had a large baby like over 9 pounds,
Oh, interesting.
high blood pressure, high cholesterol, existing cardiovascular disease, fatty liver disease, PCOS in women belonging to certain ethnic groups we mentioned, even having HIV.
That's quite a list. What about screening for type 1?
For type 1, general population screening isn't standard, but screening using antibody tests might be considered for close relatives of someone with type 1, people known to be at high risk. And there's even mention in the sources of a new therapy called teplizumab.
Teplizumab.
Yeah, it's shown some promise in potentially delaying the onset of clinical type 1 diabetes in individuals who are found to have the antibodies, meaning they're in the very early pre-symptomatic stage of the disease, stage 1.
Fascinating. Okay, so that list of risk factors really emphasizes how widespread the potential is for type 2. Once someone is diagnosed, how is their diabetes monitored over time?
Monitoring involves a few key things. Regular home glucose testing, often with a finger stick meter,
Mm-hmm.
or, increasingly, using continuous glucose monitors, CGMs.
Those are the sensors you wear.
Exactly. They're great because they provide real-time glucose data, 24/7. They show trends, catch highs and lows you might miss with finger sticks,
Mm-hmm.
give a much more complete picture.
Sounds useful.
Very. And then regular HbA1c tests are also crucial, usually done every 3 to 6 months, depending on how well controlled things are, to assess that overall long-term average.
And monitoring for those potential complications is also key, right? You don't just track sugar.
Absolutely. That's a critical part of ongoing diabetes care. It includes periodic urine tests to check for small amounts of protein, like albumin, which is an early sign of kidney damage,
Okay.
regular dilated eye exams by an ophthalmologist to screen for retinopathy, and thorough foot exams at each visit to check for nerve damage, circulation problems, or any early signs of sores or ulcers.
And there are target ranges for blood sugar.
Yeah, the sources note general goals like maybe a fasting glucose between 80 and 130, or reading under 180 2 hours after a meal, and an A1C goal typically under 7%. But, and this is important, they emphasize these goals are always individualized.
It's tailored to the person.
Exactly. Based on their age, other health conditions, risk of low blood sugar, and just their overall situation.
So diagnosis and ongoing monitoring are vital. But what about actually managing the condition day to day? What did these sources tell us about treatment approaches?
Well, the sources are unanimous on this. The absolute foundation of treatment, really for all types where it applies, is healthy lifestyle changes.
Okay, that comes up again and again.
That's paramount. That means a healthy, balanced diet, focusing on things like fiber, fruits, vegetables, whole grains, limiting added sugars, saturated fats, processed foods.
Makes sense.
It means getting enough physical activity. The standard recommendation is at least 150 minutes of moderate aerobic activity per week, like brisk walking.
Okay.
And for those with type 2, especially if they're overweight, weight loss is incredibly impactful. The sources emphasize that losing just 5 to 10% of your body weight can significantly reduce your risk if you have prediabetes or really help manage the disease if you already have type 2.
Just 5 to 10%. That sounds achievable for many.
It can make a big difference. But lifestyle is the starting point, often not the whole story, right? Medication usually comes into play.
Yes, for most people. For type 1, since the body isn't making insulin, insulin injections or an insulin pump are absolutely necessary for survival. There's no way around that.
Right.
For type 2, while lifestyle is always the first step and ongoing focus, most people eventually need medications too. Metformin is very often the first-line drug. How does metformin work?
It mainly works by decreasing the amount of glucose your liver produces and also by helping your body use insulin a bit better, improving insulin sensitivity.
Okay.
But there are many other classes of medications now. Some help the pancreas release more insulin, some help the body get rid of excess sugar through urine, others target insulin resistance in different ways. And many people with type 2 will also eventually need to take insulin injections, especially as the disease progresses over years.
And managing diabetes isn't just about blood sugar, is it? It's also managing the associated risks, preventing those complications we talked about.
Precisely. Yeah, the treatment picture is definitely broader than just glucose. It includes managing blood pressure medications like ACE inhibitors or ARBs are often preferred because they have extra kidney protective effects, which is great for people with diabetes.
Okay.
And controlling cholesterol, usually with statin medications. Managing blood pressure and cholesterol is crucial because it significantly reduces that high cardiovascular risk, the risk of heart attack and stroke that comes with diabetes.
And specific treatments if complications do develop.
Yes, things like laser surgery or injections of anti-VEGF agents directly into the eye for certain types of retinopathy. Various strategies and medications to slow the progression of kidney disease, and medications to help manage the painful nerve damage, the neuropathy, if that develops.
I noticed the sources mentioned some of the newer medications have benefits beyond just lowering blood sugar. That seems like a pretty big deal.
It is. Yeah, this is where some of the recent research really connects directly to treatment changes.
Mhm.
Some of the newer classes of medications, specifically ones called SGLT2 inhibitors and GLP-1 receptor agonists.
Okay.
They've shown in major clinical trials, the sources mention names like LEADER, MPREG outcome, Canvas, that they do more than just lower A1C. They can significantly reduce the risk of major cardiovascular events like heart attack, stroke, and cardiovascular death in people with type 2 diabetes who are at high risk.
Wow, so they protect the heart too.
Exactly. And some also show benefits for kidney protection, slowing the progression of diabetic kidney disease. These findings have really started to shift how type 2 diabetes is managed, especially in people with existing heart disease or multiple risk factors. We now tend to prioritize these drugs with proven extra benefits.
That's a significant advance. Any other treatment approaches mentioned?
Well, bariatric surgery or weight loss surgery is also presented as a highly effective option for significant, sustained weight loss and even diabetes remission, particularly in patients with type 2 diabetes who are morbidly obese.
Okay. The sources also touched on some special considerations like managing diabetes in older adults, maybe people who are frail.
That's an important point. In older or more frail individuals, the target for how tightly you control blood sugar might be relaxed a bit compared to younger, healthier adults.
Why is that?
Because aggressively lowering blood sugar in these folks increases the risk of hypoglycemia, dangerously low blood sugar. And hypoglycemia can be particularly serious in older adults, causing falls, confusion, even coma.
Right.
Plus, physical limitations, maybe vision problems or cognitive issues, can make monitoring blood sugar or taking medications correctly more challenging. So, tailored education and support systems become even more crucial for managing diabetes safely and effectively in these cases.
And patient education itself, that's highlighted as a really key part of the overall management plan for everyone.
Absolutely. Learning about the disease, how diet and exercise impact blood sugar, how to take medications properly, how to monitor glucose levels, what to do if your sugar goes too high or too low. It's all crucial. It empowers individuals to manage their own condition day to day.
Makes
The sources also mention that individualized education, one-on-one, can often be more effective than just group classes for achieving better long-term outcomes.
Okay. So all of this management, the lifestyle, the meds, the monitoring, the education, it's ultimately aimed at preventing or at least delaying those potentially devastating long-term consequences, which brings us squarely back to the stakes involved, the complications.
Yeah, this is where that chronic high blood sugar really takes its toll. It damages blood vessels and nerves all throughout the body.
And it starts with damage to the smallest vessels, the microvascular ones.
Yes, the microvascular damage. This profoundly affects several key areas. It damages the tiny blood vessels in the back of the eye, the retina. That leads to diabetic retinopathy
Which can affect vision.
severely.
Right?
It can cause permanent vision loss, and it's actually a leading cause of new cases of blindness in working-age adults in places like the U.S.
Wow. What else?
It damages the tiny filtering units in the kidneys, causing diabetic nephropathy or kidney disease. This is the leading contributor to end-stage renal disease kidney failure in the U.S., often meaning people need dialysis or a kidney transplant to survive. Those urine tests for microalbuminuria we mentioned, that's checking for early signs of this kidney damage.
Right.
So eyes, kidneys, what else?
Nerves.
It damages the nerves throughout the body, called diabetic neuropathy. This often starts as tingling, numbness, burning, or pain, typically in the feet and hands first, then moving up.
That sounds unpleasant.
It can be very painful, but sometimes it just causes numbness. And that numbness is dangerous because if you injure your foot, you might not feel it. Combined with poor blood flow from blood vessel damage, this can lead to foot ulcers, sores that don't heal.
And that can lead to...
Tragically, this is the primary reason diabetes is the leading cause of non-traumatic lower limb amputations in the U.S. A small cut or blister that goes unnoticed can become a major infection requiring amputation.
Just hearing those complications laid out, blindness, kidney failure, amputations, it really brings home the incredibly serious stakes we started with. These aren't just abstract medical terms, they're life-altering realities.
They absolutely are, and often preventable, or at least delayable, with good management.
And the damage isn't limited to just the small vessels, right?
No, there's also macrovascular damage.
Yeah.
Affecting the large blood vessels, like the arteries supplying the heart and the brain.
So heart attacks and strokes?
Exactly. Diabetes significantly increases the risk of all kinds of cardiovascular diseases, heart attack, stroke, peripheral artery disease, which is narrowing of arteries in the legs, atherosclerosis, the hardening and narrowing of arteries in general.
How significant is that risk increase?
The sources state a really sobering statistic. Approximately 2/3 of people with diabetes die from a heart attack or stroke. 2/3.
That's staggering.
It is. And what's also critical to understand is that this cardiovascular risk can start to develop even before someone has full-blown diagnosed hyperglycemia in type 2 diabetes. The underlying metabolic problems start earlier.
Are there other complications besides the vessel and nerve damage?
Yes. People with diabetes generally have an increased susceptibility to infections, bacterial infections, fungal infections like yeast infections. Wound healing tends to be slower.
Okay.
Hearing problems are also more common. And there seems to be a potential link emerging between type 2 diabetes and an increased risk of developing Alzheimer's disease later in life, though the connection is still being researched.
And mental health.
Yes. Depression is also very common among people living with diabetes. Coping with the chronic condition, the daily management, the fear of complications, it can take a significant toll on mental well-being. That needs to be addressed too.
And for gestational diabetes, just to recap, what were the main complications mentioned for the baby and the mother?
For the baby, the risks include growing too large, which can make delivery difficult. Also, having dangerously low blood sugar right after birth, potential breathing problems, and importantly, a higher risk down the road for childhood obesity and developing type 2 diabetes themselves. There's also an increased risk of stillbirth if the gestational diabetes isn't well managed.
And for the mom?
For the mother, the risks include things like developing preeclampsia during that pregnancy, needing a C-section, and then having a significantly higher chance of getting gestational diabetes again in future pregnancies and developing type 2 diabetes later in life.
Right. And we mentioned the acute complications, DKA and HHS, earlier, just reinforcing their life-threatening nature as immediate risks on top of all these potential long-term issues.
Absolutely. They need urgent care.
Okay. Given the severity of all these potential complications, prevention sounds incredibly important, at least for some types of diabetes.
It absolutely is the best strategy wherever possible. Now, for type 1 diabetes, as we said, currently there's no known way to prevent it. Research, like with teplizumab, is looking at delaying onset in high-risk folks, but not true prevention yet.
Right.
But for type 2 diabetes and for prediabetes and gestational diabetes, the potential for prevention, or at least significant delay, is huge. And it's well supported by all these sources.
And it comes back to lifestyle again.
Primarily, yes. These conditions can often be prevented or significantly delayed through healthy lifestyle changes. The sources consistently emphasize the power of eating a healthy diet.
What does that look like?
Focusing on lower fat, lower calorie, high fiber foods, lots of fruits, vegetables, whole grains, limiting the sugary drinks, the processed stuff.
Okay, activity.
Getting enough physical activity. Aiming for that 150 minutes of moderate aerobic activity per week. Brisk walking, biking, swimming, whatever gets your heart rate up.
And weight.
And crucially, losing excess weight if you're overweight or obese. The sources specifically state that losing even 7% of your starting body weight can make a substantial difference in cutting the risk of developing type 2 diabetes if you have prediabetes.
7%. That might only be 10, 15 pounds for many people.
Exactly. It doesn't necessarily mean massive weight loss. Even modest, sustained weight loss helps significantly. While some medications, like metformin, might be considered to help lower type 2 risk in certain people with prediabetes who are at very high risk, lifestyle changes remain the absolute cornerstone. They are the most impactful preventive measure cited across all the sources.
Okay. Beyond the standard approaches to diagnosis, management, prevention, the sources also touched briefly on ongoing research and the importance of a team approach to care. What's happening on those fronts?
Yeah, on the research side, it's noted that scientists are exploring areas like the role of specific amino acid metabolites. These might serve as potential early biomarkers.
Biomarkers.
Yeah, like early warning signs in the blood for type 2 diabetes and the broader metabolic syndrome. Finding things even earlier could potentially lead to new prevention strategies down the line.
Interesting.
And as we discussed earlier, the large clinical trials on those newer medications, the SGLT2 inhibitors and GLP-1 agonists, are continuing to reveal those broader benefits beyond just sugar control, which is actively influencing treatment guidelines right now.
And the team approach, why is that highlighted as being so important for diabetes care?
Because diabetes is such a complex disease, right? It affects so many different body systems. So a comprehensive interprofessional healthcare team is really crucial for optimal management, especially once complications start to develop or even prevent them.
So it's not just your primary doctor.
Ideally not, no. It involves your primary care physician for sure, but often also specialists, like ophthalmologists for eye care, nephrologists for kidney health, podiatrists for foot care, maybe an endocrinologist who specializes in diabetes and hormone disorders.
And others too.
Yeah, plus diabetes educators, registered dietitians for nutrition guidance, pharmacists who can help manage medications. They all need to collaborate, communicate with each other, and provide that comprehensive, tailored care and education that's just vital for navigating the complexities of living with diabetes long term.
This deep dive has covered a lot of ground. From those, frankly, startling global statistics and the different types of diabetes, to the underlying causes, how insulin works or doesn't work, recognizing the symptoms, how it's diagnosed and monitored.
Right.
Then the treatment strategies, lifestyle being key, but also medications, including some exciting newer ones, the very real, very serious stakes of complications, and importantly, the potential for prevention, especially for type 2.
Yeah, it's a condition that's, well, rapidly increasing worldwide. It's rooted in these fundamental issues with how the body handles insulin. And yeah, it can lead to potentially devastating complications if it's not well managed.
But the message isn't all doom and gloom.
No, definitely not. While type 1 management centers on necessary insulin therapy, type 2 is so heavily influenced by lifestyle factors. It often can be prevented or significantly managed through diet, exercise, weight management, often combined with medication. And for everyone living with diabetes, that regular monitoring and having a collaborative healthcare team, they're absolutely vital for navigating the journey successfully.
So here's maybe a final thought for you, our listener, to consider as you go about your day, building on everything we've just discussed from these sources.
Okay.
Given that stark reality of rising global prevalence, especially linked to lifestyle factors, and knowing it's increasing fastest in low and middle income countries where healthcare resources can often be stretched thin, what implications does this have for creating truly effective public health strategies worldwide?
Yeah.
How do we move beyond just individual patient care to tackle this on a massive population level when the drivers are so deeply intertwined with our modern food environment, activity levels, and just the way we live now?
That's the billion-dollar question, isn't it?
Yeah.
How do we shift environments, not just advise individuals? Lots to think about there.